When you came out as a gay man, if you had to compare that with coming out as someone living with HIV, were the responses different?
Yes, I came out as a gay man at the start of my legal practice in 1982. And at that time in South Africa, the criminal law, there were still raids on gay clubs, people arrested and charged right into the late 1980s. It was very different with coming out as having HIV and having AIDS, which I had both of them. Because it's difficult if you affirm your queerness, it's a joyful thing, but to affirm that you're living with HIV is more complex. Gay men like myself in their early 30s, professional with their lives and their hopes and dreams before them, were dying in their tens of thousands in the western east coast of America, in the Midwest, Western Europe, Australasia, but there was nothing that could be done. So you faced a certain death. Undoubtedly, I would not ever be 40. I was 33 when I was told, 32 when I was infected. I would never see 40 with certainty. I would never see a democratic, free South Africa. I would never myself become a judge, which I hope to do in a democratic South Africa. Worse was the internal shame I felt, and that's why I speak about internalized stigma, because I blamed myself. I believed that, I shouldn't have had so much sex, or sex with X or Y or Z. So there's a level of self-blame that is terribly debilitating. What changed it for me was meeting other people, and the other people I met weren't gay white men like myself. They were the spouses of mine workers who came to me when we'd started doing HIV work at the Center for Applied Legal Studies at WITS. And I was working with the unions. We were drafting AIDS codes, because by then it was becoming clear that we would have a mass epidemic in South Africa. Some of them told me that they'd never had sex with anyone apart from their husbands, and yet they felt the same shame that I did.
One of the biggest contributors to you speaking out was because you could now live. You were on antiretroviral treatment. But what we have learned is that people with HIV who started treatment at a later stage, so if you lived with a virus for a few years before being on treatment, that you're so much more likely to, for instance, have a non-communicable disease like diabetes or a heart condition. What is your experience?
I lead a healthy lifestyle, and yet I had blockages in my cardiac arteries, and I've got 3 stents in. I'm enormously grateful that I have access to the quality of medical care that is keeping me healthy. But all of that to say, Mia, that I have a sense of vulnerability. I exercise, I eat well, I'm mindful of keeping healthy, and of course, sustaining my adherence to my ARVs above 99%. If you're diagnosed with HIV and you are listening to us or watching us now, please start. And it's cheap. If you don't want to go to a government clinic, you can get your doctor to prescribe it. The ARVs I'm taking now, a Cryptiga, are costing my medical cover 222 Rand a month.
Edwin, another risk is mental health issues. How do you deal with that?
I deal with it through overactivity. I do too many things. I retired 6 years ago in August 2019 from the Constitutional Court and accepted a job as inspecting judge of prisons, which has been enormously worthwhile and enormously instructive to me, but it's been a tough job. It's kept me busy with grueling work. And I do many other things in the public sphere, talking and lecturing and seminars and interviews like this one, which I've been very keen to do because it's the first time that I've been asked about aging and HIV. So I deal with those internal issues by doing too much. And it's a functional defense against depression, but you have to recognize that.
HIV has shaped people like you. It shaped your life because such a big part of it was fighting for access to medication for everyone.
I would say that it's made me deeply conscious in a life and death sense of how important social activism is, and civic action, and popular organization. Our institutions of government and our instruments of government are important, but they have to be shaped and pressured and demanded upon by civil society action.
We started with public rollout of ARVs in 2004. We've made so much progress, and we've had buy-in from wealthier governments to help us and other African countries. And then 2 decades later came 2025, and it all almost changed overnight.
The Trump-Musk interruption of the rollout has been severe. Musk informed the aid agencies, USAID and the other grantors, that they were cut off, that they were going to be left stranded, and that all their beneficiaries across Africa and elsewhere were going to be left stranded. It created an immediate emergency, and it appears to me that government did not react in accordance with that sense of urgency, that sense of crisis.
If you were the health minister, what would you have done?
I would have jumped into action. Immediately, I would have pressed the finance minister, Gorongwana, for help to cover the 8 billion rands, which we were receiving in PEPFAR and USAID funding. I would have pressed to get to the front of the queue to ensure that that money was made available.
And now we do have a bit of hope. There is the twice yearly anti-HIV injection that we've registered in South Africa, lenacapavir, and our health department does want to roll it out and is rather committed to do it. But again, we face inequality.
It's not just income, because in a properly functioning society, you'd have far more widespread access to healthcare, and we should be doing that. But it's also agency. If you are in a rural area or you are in a very resource-deprived township, you don't live in a circle where people can simply say, oh, well, make an appointment with your doctor tomorrow morning. You know, pick up your iPhone and speak to the receptionist and get an appointment with yourself. It's much more difficult. So inequality at almost every level of healthcare access impedes the poor and enables the more affluent.
Thanks very much for your time today, Edwin.
What a pleasure. Thank you.